Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. In this segment, we're going to be speaking with Dr. Daniel Monti. He's founding director and CEO of the Marcus Institute of Integrative Health, of the Marcus Institute of Integrative Health. And he's joining us here on the program to share some tips about staying healthy while working from home and avoiding conditions such as shattered teeth from slumping on the couch or anxiety due to over-caffeinating. He's also an author, the author of the book Tapestry of Health, Weaving Wellness into Your Life Through the New Science of Integrative Medicine. Welcome to Health Professional Radio, Dr. Dan Monti. Thank you for taking the time this morning.
A pleasure to be here, Neil. Thanks for inviting me.
Well, give us a bit of your background, what's your area of expertise, and talk briefly about your role there as CEO of the Marcus Institute.
Great. And, there's actually additional exciting news in that I'm at Thomas Jefferson University, where the Marcus Institute is. At our medical college, the Sidney Kimmel Medical College, we created the first ever department of integrative medicine and nutritional sciences. I'm the chair of that department. And so that's sort of a new elevated role. And we're very thrilled about that because for the first time ever, a medical school in the United States has said, we're going to put integrative medicine on par with the rest of the medical specialties, surgery, medicine, OBGYN, dermatology, and now integrative medicine.
Great. Exciting. And congratulations.
Thank you. We're very happy because it's an opportunity to increase education to affect the way medical students think about the human body and mind-body and nutrition, things that often are not adequately covered in medical school curriculum. So this is just really exciting for us. It allows us to further our clinical trials and to continue to test the model of integrative care and many of the therapies that we've been working on and testing over the years.
Yeah, as someone, not being a medical professional myself, as I understand integrative medicine, why aren't some of the main aspects of integrative medicine covered in medical school traditionally or historically? Why has that not been? It would seem a no-brainer to me as a patient.
Right. I hear you 100%. I think that sometimes an old system changes slowly, and medical education was a certain way for a very long time. And as the field of integrative medicine began to evolve, it took a while for the rest of medicine to catch up, which is just starting to occur now. It required, I think, a little bit more data for the medical model that we've been getting over the last couple of decades. And so I think that its time has come for medicine to pay attention to. It's much different now than it even was 10 years ago, where people like me are now at the table with the rest of the medical specialists. So it's getting there.
Let's talk about some of these tips for staying healthy. I mean, we're in the middle of a pandemic. We don't see any end in sight in the near future. So it looks like we're going to be in this for the long haul. How do we stay healthy during this time? And are most of the tips things that we've all learned growing up or things that we've forgotten as we got older?
I think it's a great question because some of what we talk about in the book Tapestry of Health and that we do in our clinic with patients are things that your mother or your grandmother told you were good, healthy ways of living that we have forgotten about. Some of them are new. And the good thing is that we support the different things we recommend by the evidence, by clinical trials, many of which we did ourselves. And that's one of the reasons that the field has moved forward, because really integrative medicine, what's it integrating? The best of medicine with holistic principles and wellness-oriented strategies. And some of those strategies are things that we know, but we need to be reminded of. For example, at a time like this, it's stressful. And so what are we doing to kind of keep stress levels in check? Having a reminder to do something is important. Are we sleeping enough? Now that work schedules have become sort of blurred, are you going to bed at the same time every night so that sleep hygiene that sets off your biorhythms and gives you a restful night's sleep is occurring? Are you watching too much cable network news, which is keeping you in an anxious state when you've heard the news, but then it just keeps going on and on and on with opinions about the news, and that kind, at a time like this, the human brain is hardwired when there's uncertainty to look for information to feel more secure. The problem is that there's only so much information every day, but oftentimes, news channels kind of they perpetuate the news cycle as if there's something more that's going to be revealed. And so that's a little trick on the brain. They're very good at it. But after, the initial news for the day is revealed, there's not much more. And to keep watching sort of keeps you in that anxious state. So I often tell people sort of, cut it after a short period of time. That is the news. There's not more. You can always just glance at your phone to see if there's some breaking news update, but there usually isn't. And kind of then move on with the rest of life, because you don't want to be held in this paralysis of the fact that there's a pandemic without, an end in sight. So then what kind of proactive things can you be doing to live your best life? That's really what this is about.
So this pandemic has forced many of us to begin working from home. A lot of us weren't used to that for years and years. Now we're at home where we're normally comfortable, relaxed, doing what we want to do, not work related. How do we maintain a healthy lifestyle when we're forced to work in what should be our comfort zone?
That is a terrific question, because many people struggle with that. And I talk to people about that all of the time. One of the things that I start off with is having some, whatever your limitations are with space, but having some component of your space have nothing to do with work. Maybe that's the place where you rest and go to bed at night. It's really good if you could keep your laptop and shut down the smartphone when you go into that area of your living space. Also, many people stopped exercising during this period of time. Gyms were shut down. People felt a little bit inhibited to go out and do things, understandably, because we have to do things safely. I think finding routines that keep your body moving, because, our bodies were engineered to have activity. And when we go to a relative state of inactivity, a lot of things occur, including inflammation goes up, so people don't feel as well. Sometimes moods get depressed. Sometimes anxiety goes up. And if you're not keeping yourself active enough, then you don't sleep as well at night. And then the other thing that happens is when you're home all day and you have the wrong things in your cupboard, you tend to eat them. And so one of the things we have to be very proactive about is when we go to the grocery store, we sort of put in our cupboards and our refrigerator the foods that are going to nourish us and support us during this time, because, we're entering the colder months, and so we want to have the best possible resilience in terms of our immune health and being able to weather the storm of this next episode of life that we're facing right now. And so making sure that you have adequate nutrition, you're dealing with stress. We talk about different stress reduction strategies in the book, some of which are obvious, others maybe not so much. And also, what types of nutritional strategies make sense, what kind of snacks make sense, just based upon data and the literature that's out there. Also, people aren't going outside as much. Now that we hit the colder months, do you need to take a little extra vitamin D to make sure your vitamin D levels are good during this period of time? These are sort of the strategies because it's about resilience. It's about you being in your best resilient state to weather whatever's going on, work insecurities, pandemic unknowns, all of these things that sort of jolt us a little bit. Everybody, even people I know who have a secure job, for example, feel a little bit off during this period of time. It's normal. If you're listening and you're not quite feeling like yourself, it's because the world feels a little bit uneasy right now. And so you have to do your best to take care of yourself in a way that is really actually nurturing you versus tearing your system down.
Well, Dan, we'd like to learn more, and we'd like to get a copy of Tapestry of Health, Weaving Wellness into Your Life Through the New Science of Integrative Medicine. Where can we do both online?
the book's available on Amazon and Barnes & Noble, but our website, tapestryofhealth.net, links you to that. But we also have free webinars. We have one coming up on October 20th where we talk about some of these principles, but in greater depth. Dr. Bazzan and I, and it's hosted by somebody who really knows how to facilitate the conversation for an hour. So it's there's other resources on that website. So tapestryofhealth.net.
Great. Well, I appreciate you joining us here on the program this morning. It's been a pleasure speaking with you.
Thank you so much for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Daniel Monti. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/healthprofessionalradio.